Good afternoon, everyone. Afternoon. Appreciate your time on your busy schedules. Thanks for coming out. This is for the Black History Month agenda. Last week was been the first part of a four-part series. However, due to weather, we pushed this back to February 11th. So I appreciate everybody taking time out of your schedule and those of you attending online. So basically, the history and meaning of Black History Month. It honors the contributions of African Americans to U.S. history. Among the prominent figures are Madam C.J. Walker, who was the first woman to become a self-made millionaire, George Washington Carver, who derived nearly 300 products from the peanut, Rosa Parks, who sparked the Montgomery bus boycott and galvanized the civil rights movement, and Shirley Chisholm, who also served as the first African American woman elected to the United States House of Representatives. Initially, the celebration of Black History Month was started as Negro History Week, which was created in 1926 by Carter G. Woodson, a noted African-American historian, scholar, educator, and publisher. It became a month-long celebration in 1976. The month of February was chosen to coincide with the birthdays of Frederick Douglass and Abraham Lincoln. On February 12, 2019, the NCAACP marked its 110th anniversary, spurred by growing racial violence in the early 20th century, and particularly by 1908 race riots in Springfield, Illinois. A group of African American leaders joined together to form a new permanent civil rights organization, the NCAAP. February 12, 1909 was chosen because it was the centennial anniversary of the birth of Abraham Lincoln. Since 1976, every American president has designated February as Black History Month and endorsed a specific theme. Which brings us to this month and this year's theme. The Black History theme for 2022 is Black Health and Wellness. It explores the legacy of not only Black scholars and medical professionals and practitioners in Western medicine, but also other ways of knowing birth workers, doulas, midwives, naturopath, herbalists throughout the African diaspora. The 2022 theme considers activities, rituals, and initiatives that Black communities have done to be well. So, especially important during the time of this pandemic, this is a time for us as a community, not only as Black Americans, but also as Americans and worldwide, to focus on our health. And without further ado, I have Dr. Melanie Dice, Albany Stratton Zone, Primary Care Zone, Melanie Dice.
All right, well, thank you guys for having me. My name is Melanie Dice. I am in the Red Team, Primary Care. I'm ex-Air Force, so yeah, it's always nice to see Air Force support out there. My undergraduate was through the Air Force Academy, but my graduate work and my medical degree were through Morehouse School of Medicine in Atlanta. And if any of you are familiar with Morehouse, their motto, their credo, if you will, is serving the underserved. And to that effect, there's a lot of education that goes into health disparities. Before that was in the national lexicon, health disparities was kind of the forefront of what was being taught there. So when I was asked to kind of sit down and talk with folks about health disparities, I went a couple of different ways. It took me a long time to decide what to actually talk about because I feel like we are bombarded with statistics these days. We are all very well aware that infant mortality rates in African Americans are higher. The African American women do poorer after in labor and after. We are aware that we have worse health outcomes when it comes to heart attack, stroke, diabetes. It's there, we know that. So I kind of wanted to take this in a slightly different direction. I think that what we need to talk about more are kind of the fears that Black Americans, that African Americans experience when they encounter the healthcare system, and how we as providers and advocates and social workers and nurses and everyone else can kind of alleviate some of those fears, and then some strategies for folks to really advocate for themselves, some things that can really make you feel more comfortable in your healthcare system. So to that effect, I'm going to start with healthcare's kind of original sin, if you will, the Tuskegee experiment. Everyone has heard of this. In Atlanta, which is 1.5 hours from Tuskegee, Alabama, I encountered patients many times that would utilize the Tuskegee experiment as a reason why, well, I don't want to take that medication. I heard about that experiment. But I think a lot of people don't actually understand, one, what actually happened, and two, exactly why it inspires so much fear. So I'm going to start really simply. I'm going to ask, can anyone tell me what the Tuskegee experiment was? Anybody? Yes, ma'am. Absolutely. So the Tuskegee experiment started in 1932, and that's exactly how it started out. Now, what's very interesting about the Tuskegee experiment were that the coordinators for this experiment were the U.S. Public Health Service Corps and the Center for Disease Control at the time, or what became the Center for Disease Control. So right off the bat, you're talking about mistrust of a massive government system that was supposedly put in place to protect people. So in 1932, that's exactly what happened. We looked at they rounded up folks that actually had syphilis, that they were aware had it, and then they had a control group, around 200 or so people. And the plan was that if anyone in the control group got syphilis, they would just move them on over. No need to tell anybody about it. We're just going to follow it. Ethically, it wasn't great. The way they recruited people, we're talking about the Depression, they offered vouchers, they didn't really tell them what was going on. They had, hired people to drive them here you're just going to see the doctor real quick, that kind of thing. So people didn't really understand what they were doing. The experiment went on looking at how syphilis evolved, starting in 1932, and it ended in 1972. So that's 40 years. So I'm going to pause for a second and ask, does anyone know how you treat syphilis? Really simple, actually. Syphilis is treated, yes, antibiotic. It's treated with penicillin. Penicillin, PenVK, one shot, couple of pills. It's almost like you never had it if you treat it in time. Syphilis has 3 phases: primary, secondary, and tertiary syphilis. Tertiary syphilis, also known as neurosyphilis. Once you reach that point, those effects are irreversible. Personality changes, memory changes, things of that nature. Can anyone tell me when penicillin became readily available to most physicians in this country? That was 1947. So 15 years after the onset of the study. So there were some ethical issues, don't get me wrong, with the beginning of the study. But 15 years later, we had a known, well-documented treatment, easy treatment, that would take care of syphilis. But yet we spent another, 25 years not treating people so that we could see the long-term effects. 1972 is a long time. We were past Malcolm X and Martin Luther King at that point. We supposedly had evolved as a country. So, right off the bat, you're talking about a very large mistrust. And we didn't even really, it's one of those things that I heard my grandparents talk about, my parents talk about. I never really saw any literature about the study. No one else seemed to really acknowledge that it had happened. And then in 1997, so 1972, when the study ended, to 1997, when the federal government acknowledged that this did happen and it was wrong and issued an apology, that's a long time. So when you hear people that are getting nervous in the middle of a pandemic, with the CDC giving us guidelines that are changing and evolving on a daily basis, it's really easy to see how that becomes nebulous and really concerning. So recognizing that fear, one, recognizing it myself. I have my own fears when I enter a healthcare system. I've definitely encountered issues myself. So, recognizing that when your patients come to you or when you're advocating for a patient, that this is the kind of thing going on in the back of their head, it helps to reshape how you approach their care and how you approach them. And I think it's important to ask, is this a fear that you have? This is a well-known study, and even if people don't understand exactly what happened in the magnitude, it's the first thing that pops into their head when they think about health disparities and problems they're going to encounter in the medical system. So I think one of the other things I started looking at was, how can people better advocate for themselves? So as someone in a position, as a provider, as a physician, and as a Black woman myself, what are the things that I think people can do to better advocate for themselves? What are the things that I tell my family personally to do? The first thing that I would tell anyone to do, regardless, is make sure you are 100% honest with your physician. Your physician needs to know if you are an ethnic minority. Your physician needs to know how you gender identify. Your physician needs to know who you're having sex with. Those are important things to make decisions. It's not just something that they ask that might, maybe you don't want to share. And if you don't feel like you can be honest with your physician or your nurse practitioner or your PA or whoever you're seeing, then you probably need to find somebody new, because those things are really important. You're going to have changes in screening if you're African American when it comes to colonoscopy guidelines have changed. It's not a good example, but there's so many things. I might screen you more regularly if I know that you're African American and you have a strong family history of diabetes, for example. The other thing that I really recommend as far as advocating for yourself, and this is something I can't stress enough for everybody, you got to know your family history. That is a really, really important thing. And I think that's really overlooked. You come in, the doctor talks about medications and things like that, and family history is kind of a side note. But family history changes how I'm going to treat you, how aggressively I'm going to treat you. And it might even change, how we approach if we need to do something more conservative or otherwise. For example, my mother was diagnosed with diabetes 20 years ago. My sister has been going to her doctor forever. We were on the phone 2 weeks ago. I'm chatting with her. Oh yeah, mom's doing great. She's off all her diabetes medications. Mom has diabetes. 20 years. My sister went for her annual screening a month ago. Never checked that box. She's still in the Air Force. Without that box checked, I don't know if she's getting screened properly. I personally have impaired fasting glucose. I am pre-diabetic. My sister needs to be screened for those things. She doesn't know. She didn't know about daddy's history either. So making sure that you know every single first-degree relative. And the other thing that I think that's really tricky, especially for African Americans, our background is exceedingly diverse. The African American community is exceedingly heterogeneous. I clearly am very ethnically, genetically different from somebody else. I think we don't talk enough about some of those differences. So for example, when I was pregnant with my first, I requested genetic testing. I was advanced maternal age. I'm African American. Let's make sure that there's no sickle cell, anything like that. My genetic screening came back positive for cystic fibrosis and alpha thalassemia traits. Those are not commonly found in African American populations. So I call my mom, the baby's fine, just got my genetic testing back. These are really odd. Any comments? Well, now, I'm not going to tell you how old I am, but my mother has known me my whole life, and I spent lots of time with my grandparents. We always thought that your great-grandfather was white, but he just didn't tell anybody. They thought, based on my understanding, he was Swedish, so he was of Northern European descent. That completely changes the things that we needed to do and the things that we needed to then go and screen my husband for before. But nowhere in my life had anyone said that. I'd seen pictures, we talked about family stories. That's an important part, and I think we don't share those things enough. So for every first-degree relative, mom, dad, every sibling, half sibling, your kids, your grandkids, you need to know their health status if they're taking medications. All of those things are really, really important when it comes to your overall health. routine health screening, I think everybody says that. That is hands down, after knowing your family history, the whole point of that is the engagement in your annual health screening. Making sure that you're getting that colonoscopy, you're getting that prostate exam, you're getting your mammogram. That mammogram sucks. We all know that, but it's important and it has to get done. And making sure that if you don't understand the significance or what your risk factors are, or where your doctor is choosing to wait or not wait, making sure that you're asking that question. And it goes back to my first point, which is if you aren't comfortable enough to ask your provider that, maybe you need to look at another provider. And not everybody works well together. It's okay to say, I'm just not doing well with this person. This is how you advocate for yourself and make sure you're getting the best health outcomes. Probably the final thing that I would really say from a health perspective in African-American communities that we really do not do well, and we need to focus on better, and advocates for African-American patients should really emphasize, is mental health. I cannot stress this enough. We just saw that Miss USA decided that life was not for her, and that's horribly unfortunate, and a lovely young woman. Mental health, I think that everyone struggles with it, but I think as a community, the Black community tends to feel like we're supposed to be stronger than that. If you go to the doctor and they say you have high blood pressure, we're going to give you this medication, you don't go, no, I'm too strong for that. You take the medication. And to me, mental health is actually prong number one in your whole health. So, if you're struggling and the doctor says to you, I'm worried about you, I think we need to consider this, it's probably time to consider it. Or alternatively, if you're struggling and you don't think your provider has seen this, bring it up. I'm struggling. I'm having a tough time. My work is suffering. What do I need to do? I think that, normalizing that it's okay. Times are tough. We're in the middle of a global pandemic. This social upheaval that is going on is distressing to everyone. So recognizing that you're not alone. Mental health is one of the many prongs that if you're not taking care of your mental health, the rest is just going to go by the wayside. I think those are my big ones. I didn't really have much else. So honestly, in summary, yeah, there's a lot of fear. And I think addressing our fear, helping our patients and colleagues address their fears when it comes to the medical system is really crux. And knowing that you need to advocate for yourself. The system, we recognize it. It is a broken system and it is in the process of being fixed. But when you're sitting one-on-one with your physician, you're not going to fix the system. You have to make sure that you're advocating for yourself. And if you feel like you're in a situation where you can't, it's okay to get out of it. And that's all I have. Questions?
Have put off seeking treatment is because many of the traumas that they experienced in their childhood were basically considered to be the norm. You know what I mean? So like a parent who's a chronic substance abuse user, or a parent who's abusive, or being abused by a parent, those things you don't realize because many of your friends, or you even know family who are going through the same thing. And it's like, well, it's happening over at Tom's house too. So, it's no different than what I'm experiencing. And then also just the verbiage and the years have changed where people are actually speaking, childhood trauma and, processing your trauma and working through your trauma. Those are, more recent, terms that people can kind of understand and say, because, when working with veterans, when they've been diagnosed and they're told, well, when your father drank and he beat your mom, that was trauma that you were exposed to. It's almost like a light goes off and they're like, wow, yeah, I still deal with that. I still have, memories of that. So I think helping people to understand that behavior, what they experienced, wasn't the norm, even though it may have been common in your neighborhood or amongst your family, but it wasn't normal, and that you are probably still experiencing the residuals of that. So
Absolutely. And to build on, recognizing from a provider's perspective that generationally, the ability to open up to that idea that something that you have mentally presumed to be normal is abnormal, and that yes, you were affected by it, and that's okay. I think that we're seeing a lot of progress in that front, but recognizing that you are going to have veterans and patients that are just, they can't wrap their mind around that. That's just not something that they're used to. And finding the little steps, the little ways to interact and push them towards better mental health outcomes. So absolutely, yeah. Anything, comments?
I just wanted to add a comment. My name is Nikki. Hello?
More specifically, one of the more well-known sources of this. And I agree. I think a lot of times it's just kind of understood, or you heard what happened or what the scenario was, but it's never really discussed. And there are other sources of fear as well. In addition to that, the advocacy. I think that is huge. I mean, on all levels, you discussed the mental health scenario, but general health specifically and advocacy, I think in our communities could use a lot of push and education. I like how you mentioned the familial history and it being our own responsibility and make ourselves aware and to communicate that to our providers. And appreciate the approach. I think this is a good way, a rich way to start the series.
Absolutely, thank you.
Oh, I just want, oh, somebody want I'm tucking away the way you said about, would you say no to, like a diabetes, like if I'm asking you to take insulin, would you say no? It just truly, I mean, just this morning in one of our groups on our stud unit, a veteran said, he goes, who's been in multiple treatments for alcohol's done a dramatic change in his life. But anyways, he just today had said, not exactly what you said, but he was like, I'm finally taking a antidepressant, and I guess it's been offered to him he goes, and it's really helping me feel better.
Really,
I want to tuck that. I'm tucking that away what you said though, because I think
mental health is health.
Yeah.
And it's really a pillar. If you can't manage your mental health, I can treat you for blood pressure and diabetes all day long, but you're always going to come up against something because you have to have, I hate to use the cliche, you have to have your mind right. So getting that help, it is the cornerstone of your overall health.
Sorry, I just getting up. Really good. Understanding that this population we work with as veterans, I'm coming across a lot of veterans who are dealing with some mental health issues that's related to race. Now you're finding they're talking about how they were discriminated against in the military and how it's affecting them when they come in this hospital because they run into some similar people they met in the military who discriminated against them. And how do you put that on a service connection claim? Because it really happened. They told me stories about where, the enemy got to sit in the front of the bus where they had to sit in the back. They would capture people and they were still treated in the military like they were less than. And just this morning, I had a vet who complained about how he was treated in the VA hospital. Not taken serious, not paying close attention to what he wants. And this has been an ongoing issue here in the hospital. So we're dealing with the mental health issues with our soldiers of colors that's just being overlooked, not being treated. Yeah, we can deal with the anxiety, we can deal with depression, but the causes of it is being overlooked. And it goes to what she was speaking about, some of the stuff she was speaking about. So I'm dealing with a lot of those, and they say, well, they see my face and say, oh, you're Black. I think I'm the only African-American therapist here in the hospital, this entire hospital.
Absolutely. I mean, representation matters. hate to
And
simply-
that's what the representation, they don't see people they think can relate to them. You know, so as a VA hospital, I think we need to do better at trying to at least get some therapists and keep them when we get them. You know, because, you know, I've run across people who have left the hospital who were psychiatrists, psychologists, people of color, and they left the hospital because of the way they were treated. So it's a bigger issue, you know, but everybody has a role to play. When you have someone in front of you who's of color, and they're a vet, you know, acknowledge who they are, listen to them, you know, because their story might be different, but it's important.
And, you know, you really touched on that, you know, for a long time, and I have a lot of data because I think we're all baited out a little bit, but for the longest time, it was this impression that things just weren't fair for people of color in the military. But in the last year,
You know, I think a lot of Black Americans are used to being discriminated against by, you know, Caucasian Americans and stuff. But now we have so many, the community of people of color is growing because you have people from different countries immigrating here, and many of them are professionals in the healthcare system. But, you know, I've had African Americans tell me that a lot of the discrimination they faced from Caucasian Americans are now they're facing from people of color who come from different areas, because a lot of what happens in the greater society is basically absorbed by other cultures, and many, you know, reasons, you know, to assimilate to. But again, many African Americans feel like they're not just still like when they go to even me, and an experience I had with a GI, you know, at another hospital. I did, and this was a woman of color. She wasn't African American, but of color, but very new my story in her mind, and said things that I didn't like. And I didn't go back to her, you know what I mean? And I found someone who I felt comfortable with. But that's what people that myself and people I know have said about providers, people who are to help you. They're dealing with discrimination, and, you know, from other people who you would think would understand because they themselves are, you know, from the minority community as well. So.
Can I just add a comment just to piggyback on what Danielle said? I think that sometimes, and I can speak for myself and people, African American women, it is difficult to sit down and speak with someone who doesn't have an understanding of your cultural, they don't have an understanding of your background, they don't have an understanding of the trauma you experienced. And sometimes it's just, I get tired of educating people. I feel as if we're all professionals, we should have that knowledge and that education. And a lot of times it can be very stressful to have to constantly educate professionals on how to serve African Americans. And I think that that kind of impacts African Americans going and asking for mental health treatment. Because it's very difficult for me to sit down and speak with someone who doesn't understand my trauma, who doesn't understand my experience. And I think that really gets in the way of people going in to seek mental health treatment. You know, I recall going in for a doctor's appointment, and the doctor asked me, how was I doing? And at that time, I tried to explain, you know, with some of the violence that was going on in the media, and that stuff was upsetting to me. And the moment I started to speak about it, the doctor cut me off and changed the subject. I think there's something wrong with the audio. Maybe I'll share my thoughts for another time. Thank you.